Doctor, you're being recognized as the Dr. Edward J. Ill Physician of the Year. And you're winning this award. First of all, what does that mean to you? And then we're going to talk about your specialty.
Well, it's first of all, it's a great honor, and to me, it means that something that I've devoted my entire life to, that I think I do well, is being recognized by others as being an important contribution on my part.
We were talking earlier before we got on camera, and I was asking you how you got into the area of specialty that you are in, which is so challenging on so many levels. Tell our audience why your specialty and describe it.
Well, I've always sort of sought the toughest challenge in my life, and when I was training during my residency program, the head and neck cancer patients seemed to be the sickest on the service. Head and neck cancers really are a horrendous disease. It robs you not just of your life, but before it robs you of your personality. It involves areas. It changes your appearance. It changes your ability to swallow, to speak. Sometimes the inability to breathe. So they seem to be the most in need of help, and so I just gravitated towards treating those people, and did extra training in head and neck surgery, and eventually focused my career entirely on helping head and neck cancer patients.
How rewarding is your work?
It's extremely rewarding. I think medicine in general is rewarding. I mean, because I don't think there's any more worthwhile way to spend your life than helping people and treating disease, making them feel better. I don't know obviously lots of professions are important, but to me, I don't know how you can go wrong devoting your life in the practice of medicine.
Let's talk about this event itself, the EJI Excellence in Medicine Awards, the scholarships that are going to be awarded to young people who will go into your field, and the role of MD Advantage and all that. Why is all that so significant?
Well, I think the most significant part is not so much the awardees like me or the awards that are given, but it's the scholarships, as you say. It's a mechanism by which we can generate resources to give people scholarships so that they can pursue their dreams, and of going into medicine, hopefully, and devoting their life in the practice of medicine. I think that's the important thing, is not so much the awardees, but the purpose of the whole event, which is to raise scholarships for young people. They're the future of medicine.
When it comes to graduate medical education, a challenging area for those who care deeply about it, your commitment to it. Describe it.
My commitment to it is enormous. I think it's a very important part of my professional life, and one that gives me great joy and reward. It's really, really heartening for me when I see a medical student come in their second, third, or year, and they say they want to go into my specialty, and they're starry-eyed, and they really want to. They really don't know what they're getting themselves into sometimes, but when I have the opportunity to mentor them and sometimes train them directly and watch them mature and develop their skills over the next 5 to 7 years, and then think back on what they were like when they first walked into my office, and how since I'm sort of the chairman of the department, I give them their degrees at the end. And to realize that here's an individual that 7 years ago knew very little about the specialty, and now they are trained to the point where I would feel comfortable being their patient, having them operate on me, having them operate on one of my family members. It's a great thrill to see somebody mature that way.
Final question. You came to the United States as a very young boy from Egypt.
Yes.
What does this moment mean to you personally?
Well, I think with everything that's going on in terms of immigration, I just want to let people know that this is what an immigrant looks like. I was a refugee because I'm Jewish. It was no longer safe for me and my family to live in Cairo, Egypt, where my father, had a business, et cetera, and we basically just left with nothing but the clothes that we had, came to a one-bedroom apartment with 4 kids, lived there for that way for a long time till basically I was fortunate enough in this country to get a scholarship to an Ivy League institution at Columbia, and I did all my training there. And I think that people have to know that this is what an immigrant looks like.
Thank you, Doctor.
Thank you.